It's kind of a frightful thing because about every thing now, I think, causes cancer, unfortunately. And don't you almost get numb to it? It's almost after a while you're like, wow, is there anything I can't do that doesn't cause, doesn't have a cancer relationship of some sort? But understand that there's an association with cancer. It doesn't always mean it causes it. It took years and years and years for the label on a cigarette package to say what it says. Before it said it was associated with cancer, now it can have that strong, much stronger than association. It can have the causative. It causes it, right? That there are things in cigarettes that can cause cancer. So, and of course, not everybody gets it, right? How come not people that are like smoking until they're 100 years old don't have cancer? Why does that happen? Why does that happen? Has anybody got a really... The key is, very important, is your genes. So what happens is there is something inside of that cigarette, some sort of chemical, that clicks on a gene that starts that cell right there dividing in a way that it shouldn't in the lungs, right? Because you can have lung cancer and not smoke at all, right? And that can happen, right? So in those cases then, it's important to know that a carcinogenic agent has to have an impact on your genes. So you can say, well, I guess I didn't have good genes because it just is, genes are genes, right? So it's just how the impact will be. So carcinogens can be one of three things. They can be either, just as we said, they can be a chemical, and that's, like nicotine and the tires and things like that in a cigarette, and cigars can have that impact. So chemicals can be that way. You can also have radiation cause a cancer. Like what kind of radiation am I thinking about here? Definitely UV radiation, ultraviolet radiation is probably the one we know the best. But you know too that when you have X-ray done, right? Is X-ray radiation, is that dangerous? Is nuclear radiation dangerous? Yeah, right? Okay, ask people that were around Chernobyl, right? Are not around anymore. So definitely radiation, all different levels of radiation can be harmful, okay? Then viruses, and this has been a big deal, like the papillomavirus causing cervical cancer and things like that. So definitely viruses do have a link to potentially being a carcinogenic agent. So there's three categories. That would just be a simple test question would be, which of the following are examples of carcinogens, okay? So these three things then can cause or be associated with cancers, we should say. And of course, when we first have these things begin to work, we start with this tumor. When we have tissue that's growing out of control, unregulated, it starts this tumor. And of course, the reason that we want to know about that, and we can through something called a biopsy. Isn't a biopsy just a little bit of tissue? Isn't that right? Just a little clip of tissue, of the suspected tissue, and then looking at it underneath a microscope. So when you look underneath a microscope, of course, there's two possibilities here. Benign. I'm not spelling today. Thank you. Okay. So it can be benign or malignant. Okay, benign or malignant. Obviously, we know enough to know which would we prefer. We really like that benign diagnosis, right? Because malignant is synonymous with the word cancer. So really, a benign tumor is not a cancer. The cancer is the bad boy, right? That's the one that must be treated aggressively. Okay, so what are the characteristics? We got a great chart there with a lot of information in it. So let's slim that chart down. You see that chart in the center where it says benign, malignant? And you've got these characteristics on the left. This is great, like true, false questions or something like that. And let's look at how those four characteristics are. So let's make it easier, okay? You tell me what the first characteristic is. What is it?
Rate of growth.
Okay, rate of growth. Which one of these two grows fast and which one goes slower?
Malignant.
Good, fast growth. Okay, so let's put that down as a characteristic. And this is the slow growth. Good. What's the next little thing so we can make it easier for you here?
Differentiation.
What? Differentiation. This one's difficult to understand. Differentiation is this. When they take, now we're getting underneath the microscope now, and you guys have done some microscope work, okay? You know when you saw your cheek cell slides, and you saw other things on the slide, didn't you wonder kind of what they were, like little crystals and food particles? Remember all those things we were looking at? When you knew what the cells looked like, weren't you kind of wondering what else was on the slide, right? Well, the pathologists, once they biopsy it, they put it on a slide, and then they're looking at it underneath the microscope. And if you took it out of, let's say you've got a skin biopsy, okay, done. So what they'll do is they'll take the tissue in the area is stratified squamous epithelium, that's skin. So when they look at that and they see something that is definitely not stratified squamous epithelium, they're beginning to wonder, right? So the question is, if it looks very different from what stratified squamous looks like, would it be benign or malignant? It's malignant. The more different it looks, differentiation, the more different it looks, remember it that way, then the more it's likely to be malignant, okay? Looks different from the tissue in the area. Okay, and this one does not look as different. Okay, that one does not look as different. Okay, it looks very different from the surrounding tissue. All right, what else? What's the next one? Okay, mode of growth. Okay, so remember how I said how cancer grows? It grows like roots, right? It grows into stuff versus it has a capsule around it. It has a capsule around it. Happy days are here again. It's called what?
Benign.
It's benign. Okay, it's benign. Very easy for a surgeon to remove. Even if they can get expansive too. You know, you hear about a uterine tumor, a tumor in a woman's uterus. It's benign, but it's almost the size of a child, right? And she can carry that, right? It's kind of almost built for that, unfortunately. But they can get very expansive, even though they are benign. All right. So mode of growth. All right. So we got a capsule here, and no capsule. Good. What's the last one? That bad word. What?
Metastasis.
Yeah, metastasize. When something metastasizes, that's a weird word, metastasize, right? Or to say metastasis. When something undergoes metastasis, that simply means to move, okay? Moving, it's going someplace. And so the most common place, like say breast cancer for instance, that it seeds, and that's what the cancer's doing. It's kind of releasing itself and going off through the bloodstream to someplace else. That's how we have primary cancers in one area, but now we know that it has spread. So metastasis is a good word for spread, okay? So the bone, the liver are areas that will pick up these seeds. Lymph nodes are the most common areas that will pick up these seeds. And now the seeds begin to grow there. Of course, that's not at all the same tissue as lymphatic tissue. It begins to grow there, and now we got a real problem. So, benign. Do we metastasize in benign? No, no spreading, no metastasis. Okay, use the hard word. And then, of course, in malignant, greatly opportunity, right? Okay, so that is how you stage and grade a tumor, is based on these characteristics, right? How different does it look? How many other sites besides the primary site are affected and now have cancer growing there, right? So these are all ways that tumors are staged and graded, and that's why these 4 characteristics are important to know. And of course, pathologists use other things as well in their toolkit, but this is what we know, okay, from what we understand. Okay, so the last question would be this: how do we treat it? How do we treat cancer? Okay, what is our form of treatment? And exactly. So when we look at treatment, okay, treatment can be various. It can be, the first thing we can do is we're just going to simply do what? Breast cancer, what's the most common thing we do? We just simply, well, yeah, just take it away, right? Okay, there you go. Okay, skin cancer, what do? Cut it out, right? Just remove it. So surgical removal is a pretty common way of dealing with things. Just cut it out, okay? So surgery, and then I already heard somebody say radiation. And then what's our last one? Chemotherapy, good. And if you'll notice, 2 on this list kind of look like that list, don't they? That's the hard part about cancer and our treatment. Even though MD Anderson would like you to think different, like making cancer history, and in some cases they are, and they're very successful at it. It's hard that the ways that we treat cancer are to use things that cause cancer, isn't it? Okay, so sometimes treatments for prostate cancer lead to leukemia later, okay? So this is the problem, but it's the best thing we have, so you can't criticize the best thing we have. What's interesting is a fourth, which is not in this thing, but I want you to know it, because it's very, very popular, and MD Anderson now is getting a lot of praise for it. And that is a whole new form of therapy. And so this, they're calling it the fourth pillar, and it's not in my notes because it's just so relatively new, probably within the last 5 to 10 years that it's getting now. I mean, it was being discussed and discovered, but now it's really getting some incredible things. And this is what you'll learn next semester. And the immune system, your immune system, has two types of cells that help you in immunity. One called B cells and one called T cells. And your T cells are white blood cells, that's all they are. And they are quite capable. Every day, do you know that your cells sometimes get a little renegade? They get kind of like out of control, and the T cells move in there and they're like, dude, what are you doing? I mean, really, we don't grow like that, right? And they are capable of killing the cells that are dividing rapidly out of control. And they're very good at finding it. And so we've got these surveillance cells that do this all the time. And they're all about the business of going around and finding cancers that are developing and stopping them. So why does the cancer develop? Because it takes, you don't want your T cells going and beating up on good cells, right? That's called an autoimmune disease. We don't want that to happen, right? So T cells need to know what's you. Well, what cancer cells are quite capable of doing is disguising themselves so well that the T cell's like, oh yeah, you, hey, wait a minute, no, you're okay. And that's what it does, and it moves on. So this new form of immunotherapy helps to teach T cells what's the bad guy, right? And so immunotherapy is a new type of therapy that makes your immune system just beefed up so that it can do the job that it's normally built to do and just miss this one. Does that make sense? Does it work what? Do you know that it's most popular? This is the strangest thing about it. We had a guy who was so cool, Phi Theta Kappa, the group here, had one of the coolest guys in the whole world that's doing this research in the medical center right now. And he talked about it. Of course, it was over most of our heads, and certainly the students, but their therapies is the best for the most progressive worst that are not responsive to other therapies. That's where they've seen the best. And of course, you've got some things that happen as a result of unleashing your T cells. You've got a greater chance of having an autoimmune disorder, like a lupus or something like that, as a result, because you're letting your T cells go kind of rampant, and that's what they'll do if you so sometimes you have to fight these other little things. But it seems like the cancers that are the worst cancers are the most responsive to it that I've heard about, which is really kind of strange. And a certain type of cancer is more responsive. But they're trying this more and more now, and it's really, really cool. And certainly not going to put you through what radiation puts you through or chemo puts you through. So, but it's very specific. You can just look it up, and you can look up immunotherapy, and then look up, how the immune system's bolstered, and some of the, and of course, they're very interested. Clinical trials are so big here because we're right next to the medical center that they're always asking for new people with these cancers to come in and then try these new therapies. But it's hard to be getting a therapy or not. I mean, these clinical trials are always a challenge. But of course, they need people with cancers to test these things. But anyway, this is a big deal right now. And all you have to know is it's simply your own immune system. That's all I'll expect you to know. You don't have to know anything about the T cells or anything else. Just your own immune system, helping you to fight a cancer. And that's all that you need to know on that. But it's very fascinating. And please do some research on it. It's most fascinating, just incredible as to what could happen. To me, this is, I always think about how, if you don't ever watch Star Trek, I mean, I don't know, maybe Star Wars has a little bit of this too, but Star Trek, do you remember Dr. Spock? Do you remember that thing he had, if you've ever seen it before? He had that thing where he just run it up and down somebody, and then he instantly got information about what was making them sick. And then he could do the same thing, and then he could fix it, There's none of this, we're going to irradiate your body. Of course, they were doing the little laser beam. But anyway, the transporter room, all that stuff. But I think that to me, that's the dream, is that, cancer can be treated in a way that would not, that you don't have to cut it out. It's like, chemotherapy is like you get sick, and so they spray right all over your body because you have an ant crawling on you, right? And so it's kind of, chemo is just so heavy duty on the body, it's hard. But, hey, if it gets rid of the cancer, you know, in many cases, you want to use these